Hello, my name is Lubna Ayoubi, and today I will be presenting our QI project on the documentation of end date of antibiotics to promote best practice antibiotic duration guidelines among resident physicians. To begin, we must understand why documentation of end date of antibiotics is so important. Antibiotic resistance is an emerging global health problem linked to the inappropriate use of antibiotics, and it presents a significant threat to the efficacy of current antibiotics and the future infectious disease. This growing health crisis urged hospitals to establish antibiotic stewardships that enforce safe and optimal antibiotic practices and decrease resistance and its associated outcomes, such as complications like high incidence of C. diff, extended hospital stays, high medical costs, and mortality. Now, according to the literature, establishing antibiotic care bundles that include the rationale for and the initiation and duration of antibiotics would adequately address and reduce resistance. Proper documentation is critical to prevent medication error and extended use. In 2011, an antimicrobial stewardship package called the Start Smart, Then Focus suggested that proper antibiotic documentation elements consist of route, indication, dose, and duration. This was called RID. Another study showed a high rate of compliance with documenting route, frequency, and dose, with each of those three being documented greater than 99% of the time. The rate of documenting duration of antibiotics was only 11%. That study also found that only 8% of the patients started on antibiotics had it stopped before discharge, with inappropriate use of antibiotics during hospitalization noted to be 40.1%. This was mainly due to inappropriate duration and unnecessary continuation of antibiotics through discharge, which was attributed to poor documentation. So as we can already see, the big problem is that inappropriate antibiotic duration is mainly linked to poor documentation. Our objectives for this project were to reduce the overuse of antibiotics and medication errors. In order to do this, we were going to assess the compliance rate of proper documentation of end date antibiotic duration that was in the EMR. Our goal is to improve the rate by at least 50% by the end of April 2021 using a PDSA cycle. To establish our goal, we collected baseline data from a random sample of 40 patients that were diagnosed with UTIs and admitted to DMC Sinai Hospital between October 2020 and January 2021. When looking at the EMR, we were looking for end date documentation that was placed within the order, end date documentation within the progress note, and if the prescriber had documented day X out of total duration. For example, if they had written day 3 out of 5 of antibiotics within the progress note. We also performed a root cause analysis to identify prescribers' behaviors in documenting end date for antibiotics and any barriers to proper antibiotic documentation via a survey that was sent to residents and attending physicians. The results of the chart review revealed that documentation of antibiotic duration was very poor within the DMC Sinai system, with only 5% of charts having end date placed in the order and 0% had end date placed in the progress note. The results were further broken down to assess the documentation of resident physicians versus attending physicians. They identified that residents were more likely than private physicians to have some sort of documentation of end date, with 17.5% of residents placing day X out of total duration within the progress note, while only 5% of attending physicians documented day X out of total days. The results of our root cause analysis survey revealed that 67.5% of physicians claimed to document end date within their progress note, and 85% claimed to document day X out of total duration. Overall, 97.5% of physicians, both attending and residents, believed that documenting end date was important. For physicians that did not document end date, 73.7% stated that they put total duration in their notes instead of an end date. 15.7% stated that they keep track of antibiotic duration themselves and do not find the need to document it within the EMR. And 10.5% stated that they were not educated on the importance of documenting end date. Based on the results of our study, we noticed that there was poor adherence to the documentation of the end date of antibiotics in the EMR among prescribers in teaching and non-teaching services, despite their claims that they understood its importance. This discrepancy between the reported documentation and the actual documentation reflected a perception issue that did not translate into practice. This non-compliance with proper documentation could lead to inaccuracy in the duration of antibiotics prescribed on discharge, thus it could contribute to excessive use. We hope that once residents and faculty are educated on the importance of antibiotic duration and taught the best practice guidelines, there will be an improvement in documentation within the EMR that will positively impact the proper use of antibiotics within the DMC system. The quality improvement project is still in progress, and the team is working on tailoring the intervention based on the results of the baseline assessment and the root cause analysis survey. It will be carried out through April 2021.